Hi, my name is Michelle Donath. This is Module 1, Scientific Communication for Advanced Systems Physiology B. Thinking of planning a trip to Everest Base Camp? This short presentation highlights some important information. Everest Base Camp is 5,300 metres above sea level. Atmospheric pressure decreases as altitude increases. This makes the air thinner, so you take in less oxygen with each breath, which makes it much harder for the body to do work. At sea level, atmospheric pressure is 760 millimetres of mercury. The percentage of oxygen in the atmosphere is 21%. In dry air, the partial pressure of oxygen is 160 millimetres of mercury. However, the body humidifies the air we breathe to 100%, and this water vapour dilutes gases even further. The partial pressure of water at 37 degrees, our body temperature, is 47 millimetres of mercury. Therefore, the partial pressure of inspired oxygen at sea level is 150 millimetres of mercury. The atmospheric pressure at Everest Base Camp is 404 millimetres of mercury, and the percentage of oxygen remains the same. In dry air, partial pressure of oxygen at Everest Base Camp is 85 millimetres of mercury. The partial pressure of water vapour remains constant at body temperature. Therefore, the partial pressure of inspired oxygen at Everest Base Camp is 75 millimetres of mercury. As we know, oxygen delivery to cells depends on oxygen availability and the ability of arterial blood to transport oxygen for tissue perfusion. At sea level, the partial pressure of arterial oxygen is 100 millimetres of mercury. At Everest Base Camp, partial pressure of arterial oxygen is reduced to 50 millimetres of mercury. Hemoglobin carries oxygen in the blood. At sea level, arterial oxygen saturation is 98%. At Everest Base Camp, arterial oxygen saturation is reduced to 85%. The hemoglobin-oxygen dissociation curve demonstrates the relationship between oxygen partial pressure and oxygen saturation. Peripheral chemoreceptors detect low oxygen and recognize the body is hypoxic, which activates a cascade of responses. It increases ventilation rate, diffusing capacity, and oxygen delivery, while decreasing carbon dioxide. The kidneys compensate for the increased alkalinity by excreting excess bicarbonate and conserving hydrogen ions. Hypoxia also stimulates red blood cell production, which increases hemoglobin concentration and decreases plasma volume. So despite a reduction in arterial oxygen saturation, the content of oxygen in blood increases due to increased hemoglobin production. Hemoglobin concentration at sea level is 150 grams per litre. Hemoglobin concentration at Everest Base Camp is 175 grams per litre. Arterial oxygen content at sea level is 205 millilitres per litre. Arterial oxygen content at Everest Base Camp is 220 millilitres per litre. These adaptations cause the blood to become thicker, and the body needs time to make these changes and adapt to altitude. Ascending to higher altitude slowly over days or weeks helps the body to acclimatise and may lessen the chance of altitude sickness. Altitude sicknesses are common when travelling to higher altitudes and may strike anyone. High altitude pulmonary edema, or HARP, is a build-up of fluid on the lungs that prevents spaces opening and filling with air. HARP is a serious condition and can be fatal within hours. Symptoms of HARP usually develop within 2 or 3 days at altitudes above 2,500 metres. Breathlessness at rest is one of the first signs of HARP. Most people, but not all, also have signs of mountain sickness, including headaches, nausea, dizziness and fatigue. A cough may develop that produces white or pink frothy phlegm. Increased heart rate and elevated body temperature may also be signs of HARP. HARP symptoms are similar to having a chest infection. Immediate descent to lower altitude is the most important treatment for HARP. Drug treatments that open blood vessels may be used by trained doctors as a temporary measure. The symptoms of HARP should not be underestimated, and a rapid descent is the only treatment. Thank you. I hope you enjoyed this short presentation, and good luck for your trip.